Well, fall sports are underway, and no matter how old your student athlete is, you need to know how to prevent and treat concussions.
Our partners at Spectrum Health Medical Group have a great tool that you can take advantage of. Dr. Michael Lawrence is here today to talk about their baseline concussion testing. Before we get to the testing, can you just talk about what exactly, I guess medically, a concussion is? Because we see it happen when we attend games or watch games on TV all the time.
Sure. Concussion is really just a type of head injury. And if you looked at a continuum of head injury, concussion is thought to be the mildest form of head injury.
Okay.
Most people completely recover from concussion if it's managed appropriately. The fear is if it's not, there could be dire consequences.
And you know, when you talk about concussion, is it something that there would be symptoms of right away? You would know if your young athlete had suffered a concussion, even a mild one?
You know, symptoms can emerge over time, but most of the time you'll know right away. The problem is the athlete themselves may not. Concussion can affect thinking. It can affect judgment and insight. I recently saw an athlete, a junior high athlete yesterday, and it was the referee who caught it.
Wow.
The student athlete thought that he was fine and wanted to go back in, but clearly his judgment, insight, and memory were impaired.
Okay. So why is it so important to be able to monitor a concussion? You had said basically when you're not treating it or monitoring it or maybe testing it in such a way, that's where some real dangers can pop in.
You know, the biggest fear is what we call second impact syndrome. And that's this idea that if an individual has a concussion and is not fully recovered, he doesn't have to get hit as hard to have another concussion. And the symptoms can last longer. And in some cases, it's led to death.
Now, are there some instances where just the lack of proper fitting gear, specifically that helmet, can increase a player's odds? We're seeing football here, but of course we know there are a lot of sports that require helmets. Hockey, for example. Is it really important to have quality fitting helmets?
Without a doubt. Virginia Tech just came out with a study this past May that ranks helmets. The problem is helmets are expensive. And we see a big gap. We know that it's the junior high and high school athlete that are most at risk for experiencing a concussion. And it's this athlete that tends to take a lot longer to recover. But when you talk about funding, when you talk about athletic trainers being on the sidelines, it's this population that tends to be most at risk.
They don't have the access.
They don't have the money or the access, no.
Yeah, your group at Spectrum, you're really targeting the baseline concussion testing.
Yes.
Can you explain what that is?
Sure. What we know from research is that athletes lie. I grew up playing sports, high school, college, and you're under an immense amount of pressure. Sometimes it's internal, sometimes it's external, but you want to play. You want to stay in the game.
Right.
Research in 2004 suggested that there is approximately 40% retrospectively admitted that they had a concussion the previous season, but they didn't tell anyone about it.
Right.
So it's very important to have something objective that we can monitor when an athlete gets concussed, but also when they're completely recovered.
And that's what you have, the special diagnostic tool.
Yes, and there's a few different tools out there, but it's a computer-based test, and ideally it's used in the sense that individuals take this test before the season, and we get baseline scores on them. And then if they have a concussion, we continue to give the test until we know that their cognitive functioning has returned back to baseline. It allows some objective data to know that an athlete is safe to go back. When you look at concussions, what we know is that standard imaging, CAT scans and MRIs, the brain looks fine. It's not a hardware problem, it's a software problem.
So basically you're able to monitor the progress or the recovery because you have that normal.
We have that comparison.
Okay.
And it's individual specific.
So if it's not a CAT scan, is it a machine? Is it something you're hooked up to, or is it actually just something that's written or verbal?
It's a computer-based test that measures memory, attention, and speed of processing, all thinking abilities that we know are compromised with concussion.
Wow, pretty incredible.
So Spectrum Health Medical Group is offering tests like this. We're still, you know, relatively at the beginning of the season. I know a lot of, like, if you want to talk about high school football, you know, specifically, there's been a couple games. But still, maybe a good time to get in and be able to monitor that normal level.
Without a doubt.
What would people do? just
can get in
call
touch
up
with you?
to get in touch?
Sure. You can contact our office and call, get an appointment. The testing is relatively inexpensive, $20 to get baseline testing, so it's really worth it.
Fantastic. And you know, both my daughters played hockey for years, and you're saying that females may actually even be more prone to concussions than boy athletes.
Two reasons for that. One is that females tend to be weaker. Now, let me expand upon that before my wife kicks me out. But physically weaker. We know that concussion can be caused by an impulsive force from the body. And necks and shoulders act as shock absorbers.
Smaller.
And in the female athlete, it's just smaller. Also, women tend to be smarter. So they tend to acknowledge and admit concussion a little bit more.
Fantastic.
Well, Dr. Lawrence, thanks a lot for the information. We're going to put the information up so people can take advantage of this opportunity.
Fantastic. Thanks for being
Thank
here.
you. My
We'll be
pleasure.
right back.